Hi, my name is Dr. Erin Rushing, audiologist and owner of Comprehensive Hearing Solutions, and I wanted to talk to you today about hidden hearing loss. In order to talk about hidden hearing loss, let's recap what a peripheral hearing loss is. So, a more traditional hearing loss is uncovered by a series of tests including air conduction, bone conduction, and sometimes tympanometry and speech and quiet, depending on where you're tested. And we're looking for a mechanical breakdown of a functional part of the hearing system. And so what that results in is a loss of detection of sound. So just to remind you, if you look at an audiogram, if someone has a traditional hearing loss, their scores will be outside of the normal range. So on the audiogram, they would be higher than 20, so lower than that red line up here at the top on the chart. And so when we talk about hidden hearing loss, what we're talking about is we didn't detect a peripheral hearing loss or a loss of detection of sound. So the scores are all within this normal range at the top of the audiogram, but the person is having continued difficulty hearing. Statistics show that about 26 million Americans would fall in this category of having a normal audiogram but having hearing difficulty. So normal detection does not necessarily equate to normal performance in daily life. And so that's what we're talking about here when we're talking about hidden hearing loss. And we'll talk about some ways that we can potentially find what the problem might be. So again, to recap, normal hearing, but continued difficulty. And that leads to difficulty listening, difficulty focusing. Those are the type of complaints or issues that we see. And if we remind ourselves what we talked about in another video about Erber's hierarchy of auditory skills, is that we start at the bottom with awareness or detection of sound, and that is what is really looked at in a traditional hearing test. But we are moving up this ladder here to determine where the breakdown might be with a continued hearing difficulty. So how can we find the problem? We can go beyond traditional audiometric testing to see if we can uncover a deficit in other places. Extended high frequency audiometry allows us to test beyond 8,000 hertz. So the range of human hearing is from 20 hertz on the low end up to 20,000 hertz on the high frequency end. If you recall, on a traditional audiogram, we test between 250 to 8,000 hertz. So there is a range of hearing beyond 8,000 hertz up to 20,000 hertz that can be tested. So extended high frequency audiometry is going to allow us to test beyond 8,000 hertz up to 20,000, and it's often referred to as ultra highs or extended highs. So if we look at this chart, the box on the left is the traditional audiogram findings. So the scores are plotted from 250 to 8,000. The extended high frequencies allow us to pick up at 9,000 and test through 20,000 hertz to see if we can find a deficit or an explanation for the problems that someone is having. For speech and noise testing, what we are doing is measuring your ability to repeat speech when there is background noise present. We can compare that to people with normal hearing and normal processing to see if that's where the deficit or breakdown may be. Now, this is not traditional masking. So a lot of times in a typical hearing exam, the provider may use masking to keep one ear busy so we can accurately test the other ear. It often sounds like static running in one ear or like rain in one ear. And again, it's so we can separate the two ears for audiometric testing. In this case, the background noise is actually speech. So it simulates you being in a crowded place or a restaurant, and you have to try to repeat back what the person is saying in the background noise. What we look for is the background noises are these people at the bottom, the person talking is the person at the top, and how much louder does the person talking need to be above the background for you to understand them. And then we compare that to someone with completely normal hearing and normal processing. We get a score in the form of a number and also a category. So, depending on what we found on the other tasks, we may want to move on to some auditory processing tasks. If you'll recall Erber's hierarchy of auditory skills, the bottom starts with that awareness category. Again, that is a sound detection problem, but once we ensure that that is okay, then we can move up the ladder to comprehension. Essentially, what we're doing is moving beyond the peripheral auditory system up those auditory pathways. What are we looking at for processing tasks? It's a series of tests that we can do that present speech in difficult situations. So what we're looking for is once the environment becomes more complicated, can the hearing system keep up and extract a message from that environment? So if you have completely normal hearing and normal processing abilities, then if speech is muffled, if it's rapid, if there's noise, if you're hearing kind of two different things in each ear at the same time in those real crowded situations, you can extract enough from what you are hearing to get by and to function in those environments. So what we're looking for with auditory processing tests, or can we find deficits when we do present muffled speech or rapid speech or things to both ears at the same time? Can your system, your hearing system, and you as a person perform those tasks? So we may identify some auditory processing deficits, and we can even go as far as diagnosing an auditory processing disorder. So the purpose of today's talk was to get an understanding that we can go beyond traditional audiometric testing. And if you are someone who has been told that you have normal hearing on our traditional tests, find an audiologist who's going to go beyond and look into some of these other things we talked about today, which is not an exhaustive list, but it's a good place to start if you, again, are continuing to have hearing difficulties but have traditionally tested normal on our routine tests in the past. So I hope that this helps clear up a little bit about what hidden hearing loss is, a couple of the ways that we can look for it, and just gives you a better understanding. Thanks.